Since October is Breast Cancer Awareness Month, we've been hearing a lot about the number of people who have or are expected to get that disease. Dr. Kimberly Schlesinger is the medical director and medical oncologist at the Cancer Institute of St. Joseph Medical Center. Thank you so much for being with us.
Thanks for having me, Elsa.
I'm happy to have you here. So you say that every woman should take breast cancer personally. Explain to us what you mean by that exactly.
So what that means, Elsa, is that we are ultimately accountable for our own health, and so it's important that we understand our individual risk factors. We take into account our family history, our personal history, in terms of whether there's been other patients or other family members with breast cancer, but also too risk factors that we've occurred over a lifetime. For example, certain diets, lack of exercise, the way that we've used hormones in our life, and even our pregnancy history can impact our risk for developing breast cancer. So that the more we know about our own personal risks, the better educated we are and the more prone we are to take care of ourselves and address those risk factors.
Now, is it possible for women to control our risk for breast cancer? Is there anything that we can do?
So it is possible, but you again have to understand what your baseline risk is. For example, if there's a big family history and a family genetic mutation is identified, there are medications and other surgical options that may be able to reduce your risk of developing breast cancer. But even taking ownership of more simple, although they're not so simple in practice, choices such as diet, exercise, activity, those also impact and help to keep the risk for breast cancer down. The more active we are, the better our diet, and other choices such as alcohol. Those all come together to increase or decrease our risk. It's well known that women who have one drink a day or more for extended periods of time do seem to have an increased risk for developing breast cancer. So right there you have an option to maybe understand and make your own choices about how you live your life.
As part of controlling our own risk, I imagine that we should be vigilant about our own exams, correct?
That's exactly right. Breast self-exam is an important first step in detecting breast cancer. We know that women who perform breast self-exams once a month get more familiar with their breast and may be able to detect things sooner than they would at their annual mammogram. That's not to replace the importance of the mammogram, though. Every woman 40 and above at average risk should be getting a mammogram every year. There are some women who should be getting mammograms even earlier, but that's really determined through a discussion with your family practice provider and your OBGYN.
And I heard that you've been encouraging women to make a girls' date for their mammograms. Is that right?
So that's been a unique way for women to really support each other and remind each other that taking time out to take care of issues like mammogram or even discuss breast cancer and other issues is very important. So what a lot of women do is they make a date with each other so that they get their mammograms together or maybe go out to lunch. But the most important thing is that it becomes a supportive and a regular part of their routine.
A very smart approach. Dr. Schlesinger, thank you so much for being with us. And a reminder that you can get more information about healthful living for cancer prevention by downloading your free Healthy Living Guide at umstjoseph.org/WMAR. We'll be right back with more Midday Maryland right after this. Stay tuned.